Benefits of exercise and physical activity in diabetes management. Physical activity and exercise play a crucial role in the management and prevention of both type 1 and type 2 diabetes. Aerobic exercise, such as walking, running, or cycling, offers a multitude of benefits. It increases mitochondrial density, improves insulin sensitivity, enhances lung function, and boosts immune function. Moreover, regular aerobic activity substantially lowers cardiovascular and overall mortality risks in individuals with both type 1 and type 2 diabetes. Importance of reducing sedentary time. In addition to structured exercise, minimizing sedentary behavior is crucial for overall cardiometabolic health, particularly for those with type 2 diabetes. Prolonged sitting has been linked to increased mortality and morbidity, independent of moderate to vigorous physical activity. Recommendations include interrupting prolonged sitting with light activity every 30 minutes, which has been shown to provide blood glucose benefits. These suggestions are in addition to, not a replacement for, structured exercise routines. Sedentary behavior, such as TV viewing or desk work, significantly influences cardiometabolic health, and breaking up extended periods of sitting has been associated with improved glycemic control. Exercise recommendations for type 2 diabetes. For individuals with type 2 diabetes, daily exercise or no more than 2 days between exercise sessions is recommended to enhance insulin action. Both aerobic and resistance exercise training are advised for optimal glycemic and health outcomes. The Look Ahead trial demonstrated the profound benefits of intensive lifestyle intervention, including weight loss and increased physical activity in improving blood glucose control, cardiovascular fitness, and overall well-being for individuals with type 2 diabetes. Physical activity in youth with type 2 diabetes. While limited trials exist for youth with type 2 diabetes, encouraging physical activity is essential for their overall health. The Today study suggested that lifestyle interventions, including physical activity and dietary changes, may help stabilize blood glucose levels in youth with type 2 diabetes, aiming for at least 60 minutes of moderate to vigorous physical activity daily. Lifestyle intervention for type 2 diabetes. Prevention structured lifestyle interventions, combining physical activity with dietary changes and weight loss, have demonstrated significant reductions in the risk of developing type 2 diabetes in high-risk populations. These interventions typically involve at least 150–175 minutes of physical activity per week, along with dietary energy restriction targeting a 5–7% weight loss. The effectiveness of such interventions is supported by various studies, emphasizing the importance of adhering to guidelines for optimal outcomes. Physical activity and type 1 diabetes. Both youth and adults with type 1 diabetes can benefit from regular physical activity, but blood glucose responses can be highly variable and require careful management. Different insulin regimens, carbohydrate intake, and timing adjustments are necessary to maintain glycemic balance during and after physical activity. Overall, physical activity remains crucial for individuals with type 1 diabetes, promoting numerous health benefits and contributing to improved overall well-being. Effects of activity type and timing on glycemic balance. Understanding the impact of different types and timing of physical activity on glycemic balance is essential for individuals with type 1 diabetes. Aerobic exercise generally decreases blood glucose levels, especially when performed during postprandial periods. However, the responses can vary, and managing food intake and insulin dosing can be challenging. The type of activity, its intensity, and the individual's insulin regimen all play crucial roles in determining the impact on blood glucose levels. Management of food and insulin. With physical activity, variable glycemic responses to physical activity necessitate individualized strategies for managing food intake and insulin dosing. Preventing hypoglycemia during prolonged aerobic exercise may require additional carbohydrate intake or reductions in insulin. Checking blood glucose concentrations before exercise and making adjustments to carbohydrate intake or insulin dosages is essential. Insulin users can choose between basal bolus injection regimens or insulin pumps, each with its advantages and disadvantages, complementing regular capillary glucose tests. Practical recommendations for individuals with diabetes. For those managing diabetes, adopting a well-rounded approach to physical activity is key. Combining both aerobic and resistance exercises not only improves glycemic control, but also contributes to overall health and well-being. While each individual's response to exercise may vary, the consensus is clear. Regular physical activity positively impacts insulin action, cardiovascular health, and various metabolic markers. Considerations for type 1 diabetes. During exercise, Individuals with type 1 diabetes should be aware of the variability in blood glucose responses during physical activity. The type, duration, and intensity of exercise play crucial roles in determining the impact on blood glucose levels. It's imperative to monitor blood glucose levels before. This tailored approach ensures that individuals with type 1 diabetes can enjoy the benefits of physical activity while managing their blood glucose levels effectively. The Look Ahead Trial and Lifestyle Interventions. The Look Ahead Trial stands as a testament to the transformative power of lifestyle interventions. Through a combination of dietary changes, weight loss, and increased physical activity, participants experienced significant improvements in various health markers, including blood glucose control, cardiovascular fitness, and overall quality of life. This landmark trial underscores the importance of adopting comprehensive lifestyle changes for individuals with type 2 diabetes. Thank you for joining us on this journey, and until next time, take care of your health, stay active, and embrace the vitality that comes with a life in motion.